This video discusses the proposed project Climate Change and the Health of the Aging Population, developing a heatwave early warning system in China using the Australian-developed excess heat factor.
Over the past century, extreme heat has killed more Australians than any other natural hazards combined. To address this, a team of researchers has developed a heat and health warning system that utilises excess heat factor as a scale for public information. The system, 15 years in the making, was adopted as Australia's national emergency warning mechanism earlier this year and has already resulted in reduced heat-related morbidity and healthcare costs.
Heat waves are expected to increase in both duration and intensity as a result of climate change, leading to greater exposure to extreme heat in the population. This presents a particular challenge for older people who are more vulnerable to the negative effects of extreme heat. This includes both acute heat-related illnesses such as heat stroke, as well as exacerbation of pre-existing conditions such as cardiovascular disease, renal disease, and mental health conditions. A range of risk factors, such as these pre-existing health conditions, poor access to and affordability of cooling interventions, such as air conditioning, and a lack of knowledge about effective cooling strategies all contribute to increased vulnerability to the negative impacts of extreme heat among older people. Australia and China both have increasingly ageing populations, which further exacerbate the challenges posed by a warming climate. In 2022, China experienced its most severe heatwave to date. This, coupled with the country's ageing population, highlights the pressing need for a heatwave early warning system and risk communication materials tailored to the specific needs of older people in China. Indeed, the UN Secretary-General has recently announced a 5-year WMO target for worldwide access to heatwave early warning systems, further underscoring the need for and importance of this work. Importantly, the proposed heatwave early warning system will use the novel excess heat factor modelling tool. The EHF enables local climatic conditions to be taken into account, which will result in a targeted heatwave early warning system in each of the 24 weather districts in China. Members of the project team based in Australia have evaluated the impact of Australian heatwave early warning systems and targeted risk communication interventions, showing that these are cost-effective strategies that reduce the negative health impacts of heat waves. Thus, the proposed project deliverables will reduce morbidity, mortality, and associated healthcare costs among older people in China.
Professor Xiaoming Xi, Director of National Institute of Environmental Health, China CDC. Climate change with extreme heat has and will continue to increase excess deaths and hospital admissions, especially when we have 270 million people are over 60 years old. In 2022, we have had more than 80 consecutive days with high temperature. Therefore, we need to set up our early heat and house watering system. This joint grant application will benefit our society, especially for aging population. We provide our strongest support for this application and will provide needed assistance for the project implementation.
The proposed project team brings together international experts and emerging research leaders in their fields, including epidemiology, climatology, and risk communication. The team members have an outstanding collaborative track record, including previous ARC, NHMRC, and AusAid-funded projects on closely related topics. The proposed project will further strengthen these existing connections and practical cooperation between team members across Australia and China. The project provides an important opportunity to bring together research excellence and key strengths of the Australia and China-based team members. Specifically, members of the team based in Australia have the needed experience and expertise in the development and evaluation of the novel excess heat factor modelling tool, while team members based in China have access to and have previously analysed climate variability and population health outcomes data in China. This contributes to the project team's ability to effectively and efficiently deliver the project outcomes.